Good afternoon, everyone, and welcome back to the Fractured Mind, understanding the symptoms, prevention, and treatment options, where we bring real conversations to light about issues that matter most, our mental and emotional well being, especially within the Jamaican society. I'm your host, Janelia Glave, and today we're diving into a powerful discussion on mental health disorders. Each guest today will help us to understand a specific spectrum disorder condition that is affecting our people and why awareness and compassion, as well as education, is vital to our society. Let's break the stigma together. Welcome back to the Fractured Mind, where today we will be discussing schizophrenia spectrum disorders. Let's break the stigma together. Now, without further ado, I'm going to introduce Miss Smith and Miss Powell, who will bring forward to us the educational aspects of schizophrenia and other schizophrenic disorders. Miss Smith, Miss Powell, welcome.
Thank you for having us.
Good afternoon.
All right, so schizophrenia is one of the most stigmatized mental illnesses, especially here in Jamaica. Schizophrenia is often portrayed in a negative and crippling light within the Jamaican society, often in extreme or inaccurate ways. So, can you help us to understand what it really is and how we can address these things?
All right, so I must say that I agree fully with that statement. Jamaicans normally, when they see someone who is behaving abnormal, they would treat it in a negative light and behave like your man is a madman, that's him crazy, be careful of him, and so on. But Jamaican citizens, they need to understand that this type of disorder is from biblical days. Even in Mark 5, it describes the Gerasene demonica, in which stating that, or it proves evidence that schizophrenia is from the Egyptian days. And it's also characterized by an array of symptoms, which includes extreme oddities in perception. So this individual who has this disorder, they perceive things differently, they think differently, they act differently, their sense of self is completely different. And indications of schizophrenia includes symptoms such as hallucination, which Mr. Mitchell had touched on earlier. So hallucination, delusions, disorganized thinking, and other type of abnormal motor behavior, which can be classified into two different symptoms. So you have the positive symptoms and the negative symptoms, in where the positive symptoms would characterize with the hallucinations and the delusions, and the negative symptoms would cover the disorganized behavior and feelings of isolation and not wanting to participate in work or any other part in society.
Oh, wow. That is definitely true, and we can see it even here, but we're not quite certain on how it is linked, which is why we have these misconceptions. So, how does schizophrenia affect a person's ability to really function in daily life, in interacting with individuals like their family, forming relationships, or even at work?
Right. So, as stated before, once this individual starts to showcase, especially the negative symptoms, they feel very isolated. They try to isolate themselves from their environment, and it might affect others within their environment by giving them trauma. So they may be aggressive. Let's say it's a mom who has schizophrenia and they behave very violent to their children. So that would enhance trauma within their child, and the level of trust would be broken and the bond might be shattered if this environment does not understand the symptoms behind schizophrenia.
Definitely. And the delusions they experience can lead to unusual behaviors and beliefs. that can affect, as stated previously, their relationships with family, friends, or even work colleagues. For instance, someone that has troubling delusions might become suspicious of persons around them. And then the hallucinations, especially those auditory, can be distracting and distressing and making it hard for persons to focus on tasks, especially at work and at school.
Right. And we definitely see where the hyperactivity is evident, especially in those we know and love. And it is very important for us to be, gentle and considerate as we deal with these aspects of their journey. So, what are some of the treatment options that are available, and how effective do you believe they really are?
All right, so fortunately for schizophrenia, there are several options that are readily available, especially um, those that include haloperidol and clozapine. So these medications are broadly categorized into first generation antipsychotics and second generation antipsychotics. Other treatment methods include CBT, family-based interventions, and social training programs that help persons truly understand what the individual is going through. And we also have community support and resources that are readily available to help these individuals.
Right, right. And we care about the clozapine a lot. And though there are some individuals who often opt away from, resorting to medical treatment, it is definitely recommended and it is one of the top utilized treatment mechanisms there. So,
Definitely. So the
yes.
effectiveness of these treatment options, it is determined by the person's willingness to really seek change.
Right. So many people have never really heard of these lesser known psychotic disorders. Can you explain what they are?
All right, so we already know that schizophrenia is one of the main psychotic disorder, and this disorder stems from 6 months to up to a year. But we have other psychotic disorders which is stated within the DSM-5. One of them is known as schizoaffective disorder, and this is a diagnosis of like is somewhat of a hybrid um of schizophrenia, which is applied to individuals who exhibit symptoms of both severe and mood disorders. So, in addition to having these psychotic symptoms, this individual will experience like noticeable mood swings over a significant period of time, which would be around 2 months. We have schizophreniform disorder, which also comes from schizophrenia. It's a classification psychosis, which is actually comparable to schizophrenia, and this lasts for at least a month, but they do not last for 6 months, and they are not qualified for schizophrenia diagnosis. So this is a lesser form of schizophrenia. And an early and persistent symptoms include similarities to bipolar disorder.
Okay. And I definitely see where there are acute and chronic aspects coming out within this. And I feel as though many of us Jamaicans feel as though we're very educated on the matter of schizophrenia, but this would come to show that there are other aspects that we're highly uneducated about. And it brings the rise to awareness. So what might trigger a brief psychotic episode, and how exactly is it different from schizophrenia itself?
So, a brief psychotic episode is characterized by a sudden onset of psychotic symptoms, including delusions, hallucinations, disorganized speech, or behavior that last less than 1 month and are followed by a full term return to the individual's pre-illness level of functioning. So, schizophrenia, on the other hand, as discussed earlier, requires at least 1 month of active psychotic symptoms, along with continuous signs of disturbance for at least 6 months. which may include period of prolonged or residual symptoms. The impact on functioning is also typically more persistent and significant in schizophrenia. Triggers for brief psychotic episodes general knowledge suggests severe stress, trauma, sleep deprivation, or substance use, especially tobacco use, can sometimes precipitate such episodes in vulnerable individuals.
And what should someone do if they suspected a loved one is experiencing a psychotic episode?
All right. So it's important to know that you cannot prevent schizophrenia. In fact, of almost 108,000 persons who were treated for mental illness in clinics here in Jamaica last year, 83,000, 438 were seen for schizophrenic or psychotic symptoms. So in order to help someone who you suspect is experiencing psychotic episodes, you should first remain calm. So try to stay calm and avoid confrontation with these persons, especially when they're going through an episode. You should ensure that you're safe and then seek professional support. Educate yourself. Always remember that there isn't enough education. Always study up, find resources, attend seminars to help these persons and especially yourself to handle the symptoms that these persons are dealing with. And then advocate for these persons. Advocate for the change and the awareness in stigma for these persons and the provision of more resources here in Jamaica.
Thank you so much for that, Miss Cowell. You know, that number is quite high and it goes to show the statistics even evidently here in Jamaica. And I was gonna ask you my final question, but you really wrapped that up in a nutshell because public awareness is really built and it should be there and here in Jamaica. So thank you so much, Miss Cowell and Miss Smith, for being here today and sharing with us on schizophrenia and other schizophrenic disorder, for helping us expand our understanding beyond what we usually hear about, with the ordinary. So thank you yet again. Today's show was all about education, empathy, and awareness. Mental health is not a one-size-fits-all topic, and it's up to us to keep learning, keep listening, and keep showing up for ourselves, our family, our friends, and others. If you or someone you know is struggling, please don't hesitate to reach out to helping professionals. Bellevue Hospital is there, the Manchester Health Center is there, and there are other resources in every parish of Jamaica. Keep the conversation going. Help us help you break the stigma. I'm your host, Janelia Glave, and this was The Fractured Mind. Stay kind, stay informed, and take care of your mind. Thanks for listening.